Very warm welcome, Excellencies, ladies and gentlemen, delegates from Geneva and around the world in capitals. Today's session, as you are well aware, is a session dedicated to the WHA Resolution 73.1 on COVID. We have a session where we will hear from the co-chairs of the Independent Panel for Pandemic Preparedness and Response and an update on the ACT Accelerator. But without further ado, it's my pleasure to give the floor to the Director General, Dr. Tedros. DG, you have the floor.
Thank you, Tim. Honorable Ministers, Excellencies, dear colleagues and friends, thank you for joining us for this week's Member State briefing. Today, we have a dedicated session on World Health Assembly Resolution 73.1 on the COVID-19 response. Our briefing today will begin with an update from the co-chairs of the Independent Panel for Pandemic Preparedness and Response, IPPR, Her Excellency former President Ellen Johnson Sirleaf, and the Right Honorable former Prime Minister Helen Clark. I offer my sincere thanks for their efforts, and I look forward in joining all of you to hear about their progress. It's now 4 months since launch of the ACT Accelerator, and we're coming to the end of the startup phase. It has been a productive period for this wide-ranging partnership. Over the past weeks, there have been breakthroughs in each of the ACT Accelerator's pillars, including the evolving COVAX vaccines portfolio, the launch of the COVAX Global Vaccines Facility, and progress in identifying accurate rapid diagnostics. Today, our Chief Scientist, Dr. Soumya Swaminathan, will update on another important breakthrough, the identification of dexamethasone as the first therapy proven to reduce mortality from severe COVID-19 disease, for which WHO just yesterday issued new life-saving guidance on its use. Our challenge now will be to take the tremendous promise of the ACT Accelerator to scale. We are at a critical point where we require a significant increase in the financial and political commitment of member states. A global threat requires global cooperation. Next week, we will convene the first meeting and launch of the ACT Accelerator Facilitation Council to take stock of the progress so far and align our needs. The first council meeting will mark a crucial milestone in the ACT Accelerator as we move from our startup phase to full scale up. And I have asked Dr. Bruce Aylward to briefly update you on preparations for the council and a number of other areas, including the draft allocation framework for COVID-19 tools and the status of the COVAX vaccines facility. We're delighted that 172 countries have now joined the COVAX facility. I urge those who have not yet joined to do so by the 18th of September. It's natural that countries want to protect their own citizens first. But if and when we have an effective vaccine, we must also use it effectively. And the best way to do that is to vaccinate some people in all countries rather than all people in some countries. Let me be clear. Vaccine nationalism will prolong the pandemic, not shorten it. The only way to recover faster, be it lives or livelihoods, is to recover together. Now, without further ado, let us hear from Her Excellency, former President Ellen Johnson Sirleaf, and Her Excellency, the Right Honorable former Prime Minister Helen Clark. I thank you.
Thank you, Director General. On behalf of former Prime Minister Helen Clark and myself, I would like to say how honored we are to be jointly leading this important panel. We would like to share with you our progress and priorities and provide some important updates. First of all, we would like to thank all the member states who provided feedback on the terms of reference. We found your comments very useful and heard the following themes that emerge in these comments. We heard you highlight your appreciation for the panel's independent, impartial, and evidence-based approach. We heard you appreciate that the terms of reference are grounded in World Health Assembly Resolution 73.1. You asked that we prioritize this work and avoid going beyond this mandate. We heard you say that the panel's work should address all three levels: national, regional, and global of the World Health Organization. We heard you would like more detail and clarity on deliverables and timelines for the panel, such as a schedule of consultations with member states and the use of expert advisory groups. We heard you would also like more clarity on how the panel will engage with other relevant mechanisms, such as the Global Preparedness Monitoring Board, Independent Oversight Advisory Committee, and International Health Regulations Review Committee. We also heard you would like the Executive Board to be kept closely informed about the progress of the panel's work, including at the upcoming Executive Board special session. Finally, we heard your request that information on the resources required and time scales needed for executing the panel's recommendations be included in the final report. Once again, we deeply appreciate the effort and time you put into sharing these and other meaningful comments. Former Prime Minister Clark and I want to assure you that we will use your comments when we are finalizing the terms of reference, and we commit to continue briefing you about the work of the panel. Now I want to turn to former Prime Minister Helen Clark to discuss our next steps.
Thank you very much, Your Excellency Ellen Johnson Sirleaf. We understand we are having an issue with the connection to the Right Honourable Helen Clark. Jude, who is assisting with the moderation of the meeting, if I can just get an update for you on that situation. We're unable to connect. I'm then going to look to the Independent Secretariat for the panel and Dr. Anders Nordstrom. Anders, if I could then give the floor to you.
We will do our best to try to connect with Helen Clark. As you know, she's in New Zealand right now, and but still she should be online. But there are some problems with the connections. But we will give it a couple of minutes just to see whether we can get her as well. She's now coming on board, so that should be okay. can just, while we're waiting, introduce then myself. My name is Anders Nordström. I've been asked to head the very small secretariat that will support the independent panel. So we will be based here in Geneva and supporting the work of the panel when the panel then starts its work.
Thank you very much, delegates, participants, for your patience. I understand that the Right Honourable Helen Clark will now be coming online, and we can then resume with the meeting. Right Honourable Helen Clark, Your Excellency, you have the floor.
Excellencies, Dr. Tedros, I'm sorry for that short technical glitch. I am familiar with the statement which President Sirleaf has given, so I shall continue with our presentation from there. And I would like to join with President Sirleaf's remarks, thanking Member States for the nominations of panellists which were made, and for the informed and constructive comments which we received on the draft terms of reference. It's now my duty to share with you a little more information about the panel itself. And obviously we're pleased to have identified the panelists. We have a very, very good team, we believe, of esteemed and independent people with a good mix of skills, years of experience, and representation from across regions. When processing the nominations and considering names, we had a number of clear criteria in mind for the panel. First, of course, we were very much mindful of the criteria set out in the circular letter to Member States, such as the importance of having independent panelists who are not current political appointees. We did, as I say, endeavour to have representation from all regions. We wanted to have a broad gender balance, and we did want to see a number of specific competencies and skill sets represented on the panel. Those obviously included clinical and research expertise and experience in steering national health systems, but we also valued additional competencies, and in that we included competencies in economics because of the significant economic impact of the crisis, in diplomacy, and in knowledge of the international system. These elements have been fundamental to the ongoing response to COVID-19 around the world, and we felt that we needed this kind of range of expertise on our panel. So sharing with you the panel members that President Sirleaf and I have agreed on, they follow in alphabetical order. Mauricio Cardenas, an economist and former finance minister of Colombia. Aya Chebi, youth leader and democracy activist from Tunisia and the African Union's youth envoy. Mark Dybel from the United States of America, a professor at Georgetown University, former head of the Global Fund to fight AIDS, TB and malaria, and also of PEPFAR. Michelle Kazachkine, professor and global health diplomat from France, also a former head of the Global Fund. Joanne Liu, a Canadian physician, formerly a leader of Médecins Sans Frontières, including during the Ebola response. Precious Matsoso, former Director General of Health from South Africa, and former chair of the Independent Oversight and Advisory Committee for the WHO's Emergencies Program. David Miliband, Chief Executive of the International Rescue Committee and former Foreign Secretary of the United Kingdom. Thoraya Obaid, former Executive Director of UNFPA from Saudi Arabia. Preeti Sudan, former Secretary of Health of India and former Vice Chair of the Partnership for Maternal, Newborn and Child Health. Ernesto Zedillo, economist and former President of Mexico. And Xiong Nanshan, Professor of Pulmonology from China and Editor-in-Chief of the Journal of Thoracic Disease. Well, we are really very, very pleased that the members of this highly diverse and competent team, comprised of 7 women and 6 men, have accepted our invitations to join the panel. We look forward to convening the panel on the 17th of September and presenting to them the proposed work program, timelines, and deliverables for our work. We will also need expertise and knowledge from around the world to feed into the panel's processes. We do now have a website up and running, which we will be keeping updated. And we very much look forward to sharing more and interacting with you and seeking comment from you with respect to our work in the weeks and months ahead. The knowledge and suggestions of member states are very much welcomed and important to us, and we do want to engage regularly. We will be present again at the next member state briefing organised by the World Health Organization, and we will also be providing an update at the special session of the Executive Board in early October. Thank you for your attention, and President Sirleaf and I stand ready now to hear your comments and do our best to answer questions you may wish to put to us. Thank you.
Thank you very much, Right Honourable Helen Clark. I'm now going to ask for questions, comments from member states. Jude, as usual, will moderate those questions and comments. If you have any questions and comments, please use the raise your hand function in Zoom. We will take around 4 or 5 questions each round. And I'm going to ask Anders Nordstrom, please, to moderate this session and direct the questions to either of the co-chairs or for the Secretariat, the Independent Secretariat, to respond. Jude, with that, can I have the first list of countries who have raised their hands, please?
Thank you, Chair. We recognize the nation of France, Germany, Ukraine, the United Kingdom, and Canada. France, you have the floor, please.
Merci, Monsieur le Président. Monsieur le Directeur Général, Mesdames les Présidentes du groupe indépendant sur la préparation et la riposte à la pandémie, Mesdames et Messieurs les ambassadeurs, Mesdames, Messieurs. Je voudrais remercier tout d'abord Madame.
I would like to begin by thanking Prime Minister Helen Clark and President Ellen Johnson Sirleaf, and I commend you on your commitment and your agreement to chairing this very important panel. I'm also delighted to see that a Frenchman will be assisting you, and it is a French national who we know to be highly professional and totally independent and rigorous in their opinions and judgments. As you know, my country, alongside others, has sought to commit to supporting the steps that will be required once you have submitted your report. We certainly intend to support the analysis procedure, the way in which proposals can be formulated and put to member states. And we, as you know, have already established a non-paper about establishing and strengthening the leading role of WHO within the global health community. Madam Johnson, Madam Clark, members of the panel, I do hope that you will be able to look at our non-paper. Now, of course, this paper is not something that is set in stone, but it does set forth 10 challenges that we face and 10 things that we think could be done in order to strengthen WHO's capacity. We are trying already then to learn lessons from previous health emergencies and to ensure that the lessons can be put into practice. And of course, we're trying to look at what lessons we might already be able to draw from COVID. We worked with Germany on this, as I have said, and a lot of this also has been assisted by our interaction with the WHO Secretariat and the Director General himself, Dr. Tedros. They were always more than ready to respond to any ideas that we might have, because throughout this pandemic, once again, WHO has been a key player in meeting this global challenge. We know that a lot of reforms, a lot of lessons from previous crises have already been put forward by Dr. Tedros as a way in which we can further strengthen the WHO. This is already apparent in the 13th General Programme of Work. We certainly believe we have to build on what has already been done. Of course, our proposal is based on what has been done, but we hope it will be seen as a constructive proposal reflecting many other proposals put forward in different international fora, for instance, from the African group, but also from the G20 and the G7. We have listened very closely to our partners. We want to continue dialogue with them. This non-paper then is part of the review process called for by the WHA, and in no way are we seeking to prejudge the outcome of the ongoing work. We are simply trying to put forward some proposals that reflect some of what is already being done and some of the thinking that is already out there. We, I can assure you, as France, will contribute actively to discussion, and France and Germany are hoping to organize a further meeting on this shortly.
I now invite Germany to be followed by Ukraine. Germany, you have the floor, please.
Excellencies, dear colleagues, my French colleague has presented our ideas comprehensively and eloquently. Allow me also to congratulate the co-chairs of the independent panel and to thank them for presenting the panel members. Germany is looking forward to cooperate as closely as possible. Concerning the German-French non-paper, let me emphasize a few points, because it is also meant as an input to the work of the panel. First, it is clear the COVID-19 pandemic is highlighting the need for further strengthening and sustainably funding WHO, as well as improving its pandemic preparedness. We all have an interest in the existence of an organization that has the capacity to prevent, detect, and respond to disease outbreaks and to lead the international response. It is the WHO that has the mandate for this function. Second, strengthening WHO is necessary but not sufficient. Functioning national health systems able to deal with disease outbreaks are crucial. The compliance with the IHR in all countries around the globe is required. Capacity gaps must be identified. Assistance provided for countries that cannot cope with shortcomings due to lack of resources. Third, the non-paper builds upon already existing ideas and recommendations that have, however, not yet been implemented. Director General Tedros has spoken about measures that could be implemented early on. We support this approach. Where we can act now, we should do so. Where in-depth debate is necessary, we should not take any shortcuts, but let us use this window of opportunity and engage in this debate with a view to come to operative conclusions. Unless we undertake the necessary reform ambitiously and diligently, we risk being punished by a future crisis. And lastly, as has been said by the French ambassador, we will engage in an inclusive process, including using existing fora and governing bodies of WHO. Our aim is to strengthen the reform momentum. Thank you very much.
Thank you, Germany. I now invite Ukraine to be followed by the United Kingdom. Ukraine, you have the floor, please.
Thank you, Jude. Good morning, colleagues. Thank you very much for the very useful presentation and for very useful information. Just several questions to the members of the panel for pandemic preparedness and response. First, you mentioned about the website. When are you planning to make this site and when it will be available? And also concerning the members of this panel, fortunately I didn't hear everyone. Maybe could you just share it through the member states? It will be very useful. Thank you.
Thank you, Ukraine. United Kingdom, may I now invite you to take the floor, followed by Canada. UK, you have the floor.
Thank you. Good afternoon. Thank you to the co-chairs for your incredibly helpful update and the emails we received from Anders shortly before the session. We'd also like to thank you for the opportunity to comment on the draft tours. Overall, they were high level and potentially for us quite broad. We think one of the benefits of having a review at this stage is the opportunity to evaluate the response to date and use those findings to inform the next stages or waves of our response. And so we hope those elements will be prioritised in your work plans that you'll discuss on the 17th of September over the more horizon scanning elements, which can be done to potentially slightly longer timescales. We look forward to having continued discussions with you and to the detailed update and dialogue with you at the EB special session. In line with one of the themes that you identified at the top of the briefing session, we wonder if you could give an indication now of what progress or elements of the review you intend to be able to update us on at the special session in October, and perhaps then the subsequent milestones of the WHO in November and the EP in January. Thank you very much.
Thank you, United Kingdom. Canada, you have the floor, please.
Good afternoon, colleagues. First, let me express Canada's full confidence in and support for the two honourable co-chairs and the work of the panel. We really welcome the update provided today and the list of the panelists that you have shared. It would be really interesting to hear from the two honourable co-chairs at this point what they see as some of the key challenges and risks for the panel's work, and if they have any initial thoughts on how best to manage those. Thank you very much.
Thank you, Canada. Chair, I did not have any further requests for the floor.
Thank you very much, Jude, and thank you very much to France, Germany, Ukraine, United Kingdom and Canada for those questions and comments. Now my pleasure to introduce again Dr. Anders Nordström,
terribly
the
sorry,
Secretary.
Chair, terribly sorry to interrupt. I think we have a request from Austria.
Yeah, I think we might have, if we can take those 5 questions and comments first and allow the co-chairs to provide some answers and comments. I can just say before asking President Sirleaf to start, in terms of the website is up and running. In terms of sharing the information about what was said now, including the panelists, it's been shared with all missions here in Geneva and in New York at noon today prior to this meeting. If you have not received it, please let me know. There's always sometimes problems with email addresses, but this has been shared in writing as well. So just please let me know. President Sirleaf, would you like to start to provide some comments in terms of what we have heard? Madam, are you still with us? Connectivity is not with us today.
President Sirleaf needs to be unmuted.
Are we okay? I just wanted to say a big thank you to France, Germany, Canada, Ukraine for all the positive reaction and comments, and to UK also. I believe that the UK talked about which part of the TOR would be updated, and I'd just like to say that for all the comments we received that I've already indicated, we are in the process of ensuring that in the work plans, all of those comments will be addressed, and those work plans will be made available when we make the next report at the next meeting.
Just coming in, Anders, after President Sirleaf, Canada asked what are the key challenges and risks that we see. I think for my part, it will be to keep it focused. As we know, the the pandemic has had a wide-ranging impact. We can't go down every byway. So keeping it coherent and focused, I think, is a challenge we take on. And secondly, of course, we do not want our work politicised. So avoiding that risk will also be a priority for me. The United Kingdom asked what we would be likely to be briefing on, I think, at the Executive Board special session. Frankly, too early to say, but as we now accelerate our efforts towards the first meeting of the panel and putting to it what we believe our targets need to be in our work plan and process, I think we'll be in a position to give a good heads up next time we're in a position to come and brief member states.
Thank you. Jude, we had Austria. Do we have somebody else? Okay, Austria then, please.
Thank you for giving me the opportunity to make a very short intervention. As a member of the Executive Board, I have to be honest, I'm deeply troubled and concerned how this whole process of setting up the evaluation and the panel was set up. This was not transparent and inclusive. Also, the time given to make comments to the terms of reference was insufficient and much too short, especially during summertime. So I have the clear expectation that before finalizing the terms of reference and the work plan, the EB is properly consulted in October. Member state information is not sufficient when it comes to member state consultation. Excuse me if I have to say that, it's a very candid remark, but we have to be very careful what we are doing here. And I would like to have that this whole process is coming to a good end. Thank you very much.
Thank you very much for that comment. Unfortunately, the Director General has had to leave the room for a few minutes. I think he will be briefed about your comments and made aware about that so that that could be dealt with at the special session of the Executive Board now in October. Thank you for your comment. Jim?
May I add that we do take account of comments like this in cases where member states feel that they've not been properly consulted. We will come back to you. We will hold consultations with member states individually and collectively to the different bodies to ensure that you have the confidence that what we are doing is to ensure that the work we do reflect the mandate that you've given us and the objectives that you want to achieve from this work. So we heard what Austria had to say.
Thank you very much, Excellency. Thank you very much to those member states who made comments or questions. I understand there may be more wishing to take the floor. Jude?
Thank you, Chair. I recognize Monaco.
Oui, bonjour. Est-ce que tout le monde m'entend? Est-ce que je dois parler en français ou je dois passer?
Can I speak in French or do I have to speak English?
English, your pleasure.
Thank you.
Que ce soit à la présidente Clark ou à la présidente Salib d'être avec nous aujourd'hui. Merci pour les informations.
And Prime Minister Clark, who have been with us today, and for the information that they have given us, as well as the information regarding the composition of the group. In previous briefings, we were given information regarding the committee, on the IHR, and we know that there are other bodies that are working on assessment of the IHR. Is this something that has already been brought up within the panel? have contacts already been made with the chairs of the different groups working on IHR, so that we can ensure that we do not duplicate our work. Thank you.
Thank you very much, Monaco. Chair, over to you, please.
Thank you very much, Carol, for those comments. Anders, do you want to respond or ask the co-chairs?
Or whether any one of the co-chairs would like to respond. We can just say that the panel and the co-chairs are, of course, very well aware about the review committee that has been established and what they have been asked to do. I know that the co-chairs and the panel will try to ensure maximum collaboration in between the different processes. However, they are different and they have different mandates, different tasks, but the collaboration and the connections is already established.
Thank you very much, Anders. Jude, if there are no more questions or comments, I thank very much. DG, would you like to add anything? I thank very much the Excellencies Ellen Johnson-Sirleaf, Right Honourable Helen Clark for your presentations this morning, to those member states who questions and comments were given to the independent panel co-chairs, and to Anders Nordstrom for your role this morning. With that, I'd like to close the first part of this morning's session, the dedicated session on WHA Resolution 73.1, and now move to the second part of the session, and that's an update on the ACT Accelerator. We have with us this afternoon Dr. Bruce Aylward and Dr. Soumya Swaminathan to give us an update on the ACT. First, I think it'll be over to Bruce. Thanks, Bruce. You have the floor.
Thank you very much, Mr. Chairman. Honourable Ministers, Excellencies, Health Attachés, ladies and gentlemen, in the course of today's briefing on the ACT Accelerator, I'll provide updates on 2 or 3 key issues we've been keeping you informed on and engaged in over the past couple of weeks. And then, as mentioned, Dr. Swaminathan will provide an update, as requested again by member states, on the state of the art of some of the therapeutics work that is going on within the context of the ACT Accelerator. So in terms of the points I'll touch on, as you know, we distributed the draft of the Global Equitable Allocation Framework for comments. I'll say a few words on what we've heard and the next steps. We, of course, have been in the process of establishing and convening the first meeting of a facilitation council for the accelerator. I'll speak to that, and then provide a brief update on the COVAX vaccines facility to complement what the Director General has mentioned. In terms of the Global Allocation Framework, which is so central to the entire purpose and work of the ACT Accelerator, you see here the timeline we're working towards. At the request of member states, we extended the deadline for comments on the third, I believe it was, version of the Equitable Access Framework to last Friday, the 28th. We've now received comments from many member states. I'll give you a sense of those. And we've thus had to extend the target date for getting you a final working version of the framework, which we're anticipating will be by Thursday of next week. In terms of some of the major feedback we've received, I'd first like to thank, on behalf of Mariangela Somau, our ADG, who heads this work and is not available today, just to provide some brief feedback that she and her team will be incorporating over the course of the coming week. So first, in terms of the overall framework, there's broad support. I think a lot of interest that we look at how this applies beyond vaccines, because the specific issue of vaccines was what was emphasized within this version of the framework. In terms of the goals and priorities, there was a request for further clarification on the numbers, 3% and 20% targets, which is relatively straightforward. And then also a request that we make it very clear in the document that countries would themselves decide within countries what populations would be prioritized while recognizing the rationale for the 3% and 20% targets. There were also then questions of clarification on the timing, the allocation logic, and some of the operational issues which you see listed here, particularly with respect to the stockpile and how that would be used for humanitarian settings, and then some specific questions on the governance of the mechanism and how that links to the COVAX facility. So all of these issues have been taken on board. Some of them, and a number of them, are actually in the document already, but clearly without sufficient detail or presented in a way that make them readily accessible. So this is great guidance that we'll take on board now as we move forward and have the next version for you by the 10th. So in terms of the ACT Facilitation Council, first, we've been asked by a number of member states about the planning for this, especially those which would be represented on the council. The formal invitations are out today, although there's been informal discussions with many of the members. Attached to those are the terms of reference, which we will also make available to all member states, the draft terms of reference as promised, and we'll try to get those out in follow-up. Perhaps we could do that, Tim, to this meeting. We could also post the terms of reference for the Facilitation Council. These terms of reference will be in draft until they're reviewed by the Council itself next week. We'll have a short briefing tomorrow morning for those member states that are actually participating in the Council to just help for the preparations, because this is such a very short time frame for a meeting like this. Then we'll be getting out some of the key documents on Monday. That will be the status report on where we are with the ACT Accelerator. It's a brief report, what's been achieved in the startup phase over the last 4 months, as well as the plan, especially for the next 3 months, the critical things that need to happen over the next 3-4 months to keep us on track as we move from sort of the startup phase to what we now call the scale-up phase. And that requires big decisions now, and really at a political level about investing in the Council, and then also collaborating through some of the mechanisms established by the ACT Accelerator to be able to ensure equitable allocation of these products. So we'll also share those, the investment case, as well as the status report and plan with all member states. We'll make those available on hopefully Monday evening at latest. They're relatively brief, concise documents that'll help, again, give people a better understanding where we are, where we're headed, and what the challenges are as we move forward. Those documents I'd like to highlight will also be in draft until they've actually been reviewed by the Council, at which time we'll take on board, obviously, the suggestions, recommendations, and finalize those documents. The Council meeting itself, the first, will be on 10th of September, and then we would anticipate providing a briefing to the member states on the outcomes on the 17th. In terms of the final, the final Council composition, you see it represented here, and it'll be available in the documents afterward. We were alerted to a couple of additions and adjustments, and have made those, as you see, reflected by the small arrows on this on this page. Again, we'll make that available right after the meeting. The last point I wanted to make was just in terms of the COVAX vaccines facility. Of course, we had an important date this week, which was, pardon me, if we can go back to the slides for a moment. Are we able to project the slides again for a moment, please? I will try and not skip past the last slide. Sorry, a bit of a delay here. Okay, here we go. So this is an update on the COVAX Global Vaccines Facility. On the right-hand side, you can see the key dates for the self-financing countries who would want to participate in the facility. And you can see the 31st of August was the target date for countries to move from an expression of interest to a confirmation of intent to participate, and in doing so, to explain whether they would like to participate in the purchase doses or confirmed doses option, or the optional to buy doses approach. There's different ways, of course, as well as to express some other specifics with respect to their participation. So in terms of where we stand on that, you see on the left-hand side the number of countries now that have actually confirmed their intent. So extraordinary 78 high-income and upper-middle-income countries have now confirmed, submitted their confirmations to participate in the global vaccines facility, which is fantastic. We already know that that number will grow. We've been told by a number of countries that they are still in the process of finalizing their documentation and will be submitting in the next few days. But really and that, of course, those countries will join with the Gavi COVAX AMC eligible economies and countries for a total of 170 now countries and economies that are most likely confirmed to participate in the facility. But really now we're already looking forward to the 18th of September. That's the next key date when countries will need to submit their binding commitments to the facility in advance of then beginning the upfront payments and financial guarantees that will allow us to move forward with some of the deals and purchases that would need to be made on behalf of the participating countries. So this is great news. The Director General spoke to it already. We'd like to recognize and thank again all those countries which have confirmed their participation and look forward to others continuing to join so that together we can ensure the equitable rollout of vaccines to ensure the greatest possible impact for health reasons, for health systems reasons, to get societies reopened, and increasingly it's evident the global economy. With that, Tim, I suggest we pass to Soumya for the update. Our Chief Scientist, Dr. Soumya Swaminathan, will now provide an update on where we are in terms of therapeutics work within the accelerator.
Thank you very much. Good morning, good afternoon, and good evening to your excellencies from all over the world. What I'd like to do today is to provide you an update on the therapeutics that we are evaluating and making guidelines on, and spend a little bit of time in talking about the process that we use to update our evidence and make guidelines, because this is something that's very critical and is a core function of our norms and standards work. Where do you point this, Bruce? So the key principle behind WHO's guidelines and recommendations is, of course, to ensure the rigor, the quality, the speed, and the design so that we can have the maximum impact. And as we all remember, one of the key transformation decisions in 2019 was that all the normative and standard setting products should follow a fit for purpose, quality assured process, and it should be clearly assessed against the needs and priorities of the member states and be linked with country impact. And so when we set up the Quality Assurance of Norms and Standards department within the newly created Science Division, we had several new functions that were enabled, including prioritizing the global goods. So trying to reduce quantity but improve the quality, through a 3-level mechanism working with our regional and country offices, making sure that we have a standardized process, that every product goes through standardized and quality assured development pathway using the most up-to-date and relevant methodologies, and that there is, of course, this new department, the Q&S department, which is basically an enabling and cross-cutting department that supports the methodological work on quality assurance. It ensures monitoring and evaluation and manages joint planning. And we will see how this is really played out now in doing guidelines during an emergency. It's very hard. Okay, maybe someone will control it for me. So the main agreed principles, 2 stages. So first is the planning stage, where of course the technical department that is wanting to produce the new guidelines comes up with a proposal, and depending on whether it's a data product or a research product or a normative product, it goes through either the data and delivery division, it goes through the research for health department or the norms and standards department. In the case of emergency guidance, the emergency program is responsible really for for both planning and implementing it. And then towards the end, when the product is ready, it goes through an executive quality check. And then the final quality assurance is provided by the science division. And some of the principles behind it is really, is there a clear process that's being used? Have the methods been appropriate? Is the reporting and presentation in the right format? And is there a plan for both impact and evaluation of the new product? Now, during a public health emergency of international concern, there is, of course, a need for speed, but at the same time, we have to keep the focus on the rigor of the scientific process. So the processes that WHO normally uses is the SAGE, which is a scientific advisory group of experts on immunization that makes recommendations on vaccines use and will do so for the COVID vaccines as well. Then the Guideline Review Committee, which generally reviews all guidelines that provide a recommendation either for a clinical or a public health question. And now the newly created Publications Review Committee, which reviews the emergency rapid advice or interim guidance. If there's limited evidence, then we do an interim guidance. And this is a much more faster process. It's an expedited process, but it uses the same criteria that the Guideline Review Committee uses. And supporting and helping this is now this new collaborative, an evidence collaborative for COVID-19 network, or the ECC19. This is a voluntary consortium. Currently over 190 experts from more than 90 organizations are contributing to the evidence retrieval and evidence synthesis. We need to do this meta-analysis or evidence synthesis on a regular basis. And so we have a number of collaborating centers, as I mentioned, that are helping us with this living network meta-analysis, which is also on our website. So at any time, you can have a look at what is the latest on drugs or on vaccines in terms of the current evidence base. And then we are coordinating prospective meta-analysis, particularly for some therapeutics. And I'll say a little bit about the corticosteroid guidance that was released yesterday, but also drugs like ritonavir, lopinavir, remdesivir, hydroxychloroquine, convalescent plasma, and so on. And then we're using, again, a new approach called the MAGIC, which is basically making the graded evidence easily accessible to people. It's a software program used for this living network meta-analysis, and I would like to thank Norway for support on this particular piece of work. So what we do, and this is our website, of course, where you find all of the technical and operational and scientific guidelines. We've done more than 800 as of date. It then, once it goes through this quality assurance process, it goes up on our website. And I should mention that this Publication Review Committee is not only composed of staff in headquarters, but has significant contributions from our staff in the regional offices. And we've been seeing 4 to 9 million downloads every month. And this is a significant uptick on the number of downloads as compared to before the pandemic. And I would just like to say 2 words about the GRADE methodology that's used to make recommendations. And there are 2 components to this. The first one is really looking at the evidence behind a recommendation. And this is based on the quality and the quantity of the studies that have been done, the research findings and the data. And it can go from very low to high level of confidence in the data based on the, as I said, on the type of studies, both on the quality and the quantity. And then the guideline development group actually makes also a grading as either strong or weak. And this is based on the quality of the evidence, but also based on other factors that they take into consideration. And you probably can't read this very well, but essentially when we say something is a strong recommendation, what it means for patients is that most individuals in this situation would want this recommended course of action. And for policymakers, it would mean that in most countries and situations, this guideline would be implemented and would go into policy. Whereas a weak recommendation is again, needs to be viewed in the context. There are risks and benefits that individuals or policymakers might want to look at before they decide whether or not to implement that particular guideline. So again, it's running ahead. So yesterday we released the guidelines on the use of corticosteroids. And this was very much something that was awaited because, as you know, there was this large trial called the recovery trial done in the UK that released some preliminary results in June and then had a publication on the 17th of July, basically talking about the positive results that they received when dexamethasone was given to seriously ill hospitalized patients. The guideline development group that met on the 6th of July told us that they would like to see the results from the other ongoing studies of corticosteroids, because of course there were a number of ongoing studies, though the recovery trial was the biggest trial. And so what we did something called a prospective meta-analysis, and we are very grateful to all the researchers who agreed to share their data with the WHO so that we could do pooling of data and coming up with much stronger guidelines based on not just one trial, but 7 or 8 trials pooling together gave us a much better evidence base. And then this went back to the Guideline Review Committee, and basically, to summarize, there are 2 recommendations. The first one is that systemic corticosteroids, which means steroids given orally or intravenously for the treatment of patients with severe and critical COVID-19, has a strong recommendation. And the other important one is that steroids should not be used for the treatment of patients with non-severe COVID-19. And the other good thing about corticosteroids, particularly dexamethasone, of course, is that it's a low-cost intervention, it's widely available, it's easy to administer, and therefore can make a significant difference by saving one person from dying out of every 11 or 15 people treated. But again, important to remember, it's only for a subgroup of patients who are in hospital, who are receiving either oxygen or other kinds of respiratory support. And simultaneously with the release of our guidelines yesterday, we had the publication of all of these clinical trials in the Journal of the American Medical Association, and the links are provided for those who are interested. So it was a coordinated release, both of our guidelines and the evidence, so that people are very clear about what we're saying and what it's based. Now, there's been a lot of interest in convalescent plasma therapy, because obviously this was one of those therapies that has a lot of scientific basis behind an expectation that it would be helpful. And currently the Clinical Research Working Group is reviewing all the ongoing trials on convalescent plasma therapy, and we're again doing the same thing. We're pooling the evidence. There are a large number of trials going on around the world, and it's important to look at that data to see if there are signals of either benefit or harm. And at the current moment, we still recommend that convalescent plasma should be used in the context of clinical trials, or if that is not possible, under what we call a MURI protocol, which is a monitored emergency use of products which are still unlicensed, but they're used in a research setting so that data can be collected and used to make the evidence. And then finally, I'd like to give you a short update on where we are with the Solidarity trials on therapeutics. In fact, we have crossed a landmark yesterday. You can see that we have over 10,000 patients now randomized, making us one of the largest trials in the world for COVID-19. You can see on this map that we have large number of countries, over 27 countries who are currently enrolling patients, but in green are all the countries that have received approvals and are ready to participate. And in these 27 countries, we have over 450 hospitals and literally thousands of doctors who are participating in this. And since it started in the first week of April, you can see the enrollment in this trial has been very robust. Again, many thanks to all the member states as well as all the participating doctors and hospitals. Currently, we're enrolling 500 to 600 patients a week. And this is the kind of trial that actually can provide definitive answers to the questions that we want to know about, which drugs are safe and effective. So as we go into the next phase of the Solidarity trial, which is it's an adaptive design, so you can drop drugs which have either shown efficacy or which have shown futility, and we can add new products. And so currently we're in the process of adding an immunomodulator arm, and as well as the monoclonal antibodies, which currently there are several of them undergoing phase 1 and 2 trials, and these are promising for treatment as well as for prevention of COVID. And so we will see a number of trials happening with those products. This slide basically just to show that a large number of clinical trials have been registered and conducted from around the world. And so there has been a huge worldwide effort. And this is a very good thing. But the downside, of course, is that you have too many small trials which are unable to recruit, which cannot complete, or which come up with inconclusive results. And so while it's really good that so much research is happening to add to the science and the evidence base on COVID, and we've learned so much in the last 8 months, there is a need for better coordination both nationally and globally in order to do trials which are efficient, which provide the right answers in a timely manner. And so my last slide is really to talk about why we would need something similar for vaccine candidates, and we're in the process of discussing with many of you. The Solidarity trial for vaccines would be conducted through a network of networks based in different regions and countries. It would be again a joint collaborative global effort with several co-sponsors, with several co-funders, evaluating many different vaccine candidates, trying to give the best possible chance for all vaccines to prove efficacy and safety, enrolling participants at sites with high rates of COVID-19 so that you can get results within a few months of introducing a new vaccine into this platform. It would be run at multiple vaccine candidates could be tested against a common control arm, thereby eliminating inefficiency of designing and conducting separate trials. And again, would show global solidarity, international collaboration, and countries' commitments to really achieve the goal of having safe, effective, affordable, and accessible vaccines for COVID-19. So I will stop there, and Bruce and I will be happy to answer questions on these two presentations. Thank you.
Thank you very much, Soumya. Thank you very much, Bruce. Again, member states, delegates, excellencies, if you do have a question for either of our presenters, please raise your hand in the Zoom chat function, and Jude will take a list. Over to you, Jude.
Thank you, Chair. We recognize Ukraine. You have the floor, please.
Yes, thank you, Jude. Thank you very much for the very useful presentations. It was very comprehensive and very useful. I have a question to the Chief Scientist concerning the usage of ivermectin and oleandrin. Whether the Chief Scientist examined this possibility and using of these drugs, and if yes, what is the result? Thank you.
Thank you, Ukraine. I do not see any requests for the floor. Chair, over to you, please.
Thank you, Jude. Over to Soumya, please, to take that question.
Thank you, Ukraine. I did not hear the name of the second drug. I did hear ivermectin. Could you please repeat?
Yes, of course. Oleandrin.
Yes, these are some of the drugs that have been proposed to be effective. There are a large number of therapeutic products that are being tried. Many of them at the beginning of the pandemic were repurposed drugs. like ivermectin, which have been used for other diseases, like hydroxychloroquine, like the antiviral drugs that have been used against HIV, against influenza, against hepatitis. The idea was that these may be effective also against this new virus. And so a number of trials started at that time. Some of them were observational studies initially. Then there were a few clinical trials. And then later on in the pandemic, we started actually looking at products which are much more specific against this virus. Remdesivir, of course, is a drug that's an RNA polymerase inhibitor, previously tested against Ebola, and therefore was thought to be used against this virus, which is also an RNA virus. But there are now new antiviral compounds that are being developed, which are much more specific. There are also biologics, the monoclonal antibodies, which are more highly specific than the convalescent plasma or hyperimmune globulin. So in terms of the ivermectin and the oleantomycin, there are at present really no evidence to support or to refute their use for this indication, for COVID-19. As I mentioned, we are constantly doing a living systematic review, which is also available on our website. And so if you go there, you can look at any drug or any class of drugs and look at all the clinical trials that are going on around the world and what the results are currently. And as soon as there is an evidence base for any drug, we will update our treatment guidelines. Maria might want to add to this, but at the moment, we do not recommend the use of any specific drug for COVID-19 because there just has not been that evidence base. But over the next few weeks, as I mentioned, we will be looking at lopinavir, ritonavir, at remdesivir, at hydroxychloroquine, and our guideline development group will come up with recommendations on those drugs. Thank you.
Thank you, Soumya. Back to Jude. I understand there's another member state wishing to take the floor.
Mexico, you have the floor, please.
Thank you, Jude, and thank you for both presentations. We also have a question for the chief scientist. We saw the article published in The Lancet about the Solidarity trial on vaccines. And in the article, it is mentioned that 250 sites will be participating or are interested in participating. Could you please provide additional information on how we can obtain additional information on how countries can participate, and when do you foresee to start enrolling patients for this trial? Thank you.
Thank you, Mexico. I recognize Canada. You have the floor, please.
Thank you very much, Bruce and Dr. Soumya, for that. I have a somewhat unrelated question, but I hope that someone will still be able to answer. We have a specific question on flu vaccination, and Ottawa was wondering, does WHO plan to update guidance on flu vaccination in light of COVID-19, particularly as it hasn't been updated in many years? Thanks very much. Over.
Thank you, Canada. There are no further requests for the floor, Chair.
Thank you very much to Mexico and Canada for those questions. First, I'll ask Dr. Soumya, Chief Scientist, to respond to the question from Mexico.
Yes, thank you very much, Mexico. I think that's a very good question. So a few weeks ago, we had put out on our website a call for sites that might be interested in participating in the Solidarity vaccine trial. We also had on our website the core protocol that had been developed again by an international group of experts. We have the target product profiles for the vaccines, and also we have criteria for prioritization of vaccine candidates for inclusion in this trial. So in response to that, the announcement, we had interest from over 250 sites from all around the world. And they've been on calls with the team here, basically trying to learn and understand more about how this trial would work. What we would do subsequently really is to write to member states that are interested. So I encourage you to please write to me if you're interested in being part of the Solidarity vaccine trial. We will then have a memorandum of understanding with the Ministry of Health in the member state, and then have discussions on the sites that could be selected within the country based on both the capacity to conduct a vaccine trial, but also the epidemiology of the disease. So we would like to choose those sites which are expecting an increase in cases over the coming weeks and months, or where there is ongoing transmission, so that you can enroll and get endpoints much more rapidly. In terms of timelines, currently we have received from 17 different manufacturers and developers of vaccines an interest in having their candidates be part of this trial. And so we've again set up an independent expert group that's evaluating the dossiers of all of these different candidates, and will come up with a prioritization. We could start with maybe 1 or 2 or 3 candidate vaccines, but the idea is, as more of them complete phase 1 and phase 2 and have enough data for this committee to look at, we would then potentially be adding more vaccines to the trial platform. So the timeline is perhaps 4 to 6 weeks from now is when we would really aim to get started, and so this is a good time to start discussing the details with the Ministry of Health as well as with the participating sites within the country. So I will be very happy to provide more information and to have a one-on-one discussion with those who are interested in learning more about the Solidarity vaccine trial. Thank you.
Thanks very much, Soumya. And to the question from Canada in relationship to flu, I'd like to introduce Dr. Maria van Kerkhove for the first time today. Maria, you have the floor.
Thanks, Tim, and thanks, Canada, for the question. So yes, the flu recommendations are always reviewed to look at the risk groups that are recommended, and the same risk groups for flu this year apply as they did last year and in many years. I think what is really, really critical as we enter into the flu season in the Northern Hemisphere is that flu vaccination uptake is increased, and that we try to maximize flu vaccination this year. There are a number of reasons for this, but I think most obviously the flu vaccine protects against flu. But secondly, given COVID-19 circulation as well, there will be a very difficult clinical picture for an individual and for frontline workers who are dealing with patients with respiratory illness. And so as much flu vaccine that can be administered, I think this will be very beneficial for not only flu, but for COVID going into the fall. So we do stress the importance of flu vaccine, but just to also say that we do always review the recommendations that we put out in light of should there need to be any change. But the risk groups that we recommend for flu vaccination still remain the same.
Thank you very much, Maria. Jude?
Peru, you have the floor, please.
Thank you very much, Jude. A quick follow-up question to Dr. Soumya based on her response to the very pertinent question posed by Mexico. Is there a limited number of countries that you are looking for participation in the Solidarity trial on vaccines, or this effort is basically open to any country willing to participate, as it is the case for the Solidarity trial on therapeutics? Thank you very much.
Thank you very much, Peru. No further questions.
Thank you, Peru, for that question. There's no limitation on countries. We're happy to work with any country that's interested in participating. Of course, as I mentioned, the prioritization of sites would be based upon a number of criteria, including the presence of ongoing transmission, and then the capacity for participating, for the capacity to have conducted trials, so experience in having conducted trials, the willingness, of course, of the government to support and be a co-sponsor for the trial. So those are the kind of criteria which are much more practical and operational criteria. But in principle, we're very happy to work with anyone, any country that would like to be part of this There are absolutely no restrictions. Thank you.
Thank you very much, Soumya. With that, if there are no further questions or comments from member states, I'd like to thank all the panelists again today, and thank you very much to member states for your engagement on what has been a very exciting and interesting session dedicated to Resolution WHA 73.1. Just a heads up that next week we will not be having a session on COVID, given that it's the Regional Committee of the Southeast Asian region of WHO taking place, and also that it is a holiday here for many of us in Geneva. So with that, I thank you very much for your attendance today and look forward to seeing you in 2 weeks' time. Thank you very much.